Good morning, guys. So today I've decided to do another vlog because I have a special patient today, and my patient is actually my boyfriend Frankie. He's in the shower right now, but I was like, why not vlog it? Then he's gonna be able to vlog the things I, do to him, and you get like the real insight of what a dental hygiene student really does. So yeah, so today should be fun, and he's actually a holdover patient, so I'm gonna finish him today, and he's my patient for both AM and my PM session, so we're all good. Planning to do laser on him, so that's gonna be fun. That cannot be recorded just because laser can reflect off of shiny things or whatever, just for safety reasons. But I will be doing laser on him before I debride him, and I'm excited. Okay, you guys, so the beginning of the appointment actually was not recorded, but all I did was do the medical history, health history check. Basically, I just look for all of the medications they take, any diagnoses, any surgeries that they had, any like hip replacement or any artificial joints really, and see if they also need to take pre-medications. And then after that, we did vitals. That one wasn't recorded either. And if all is normal, then we go ahead and continue with the appointment, which is to do the oral cancer screening, and we do it on every patient. And this is actually what I'm doing right now. I started off with extra oral, and it's basically just palpating his entire head and neck region. I also go down to his like clavicle area, which you'll see me do. It gets kind of ticklish for most patients, especially my boyfriend is really ticklish. But basically, we just palpate the entire like head and neck, like I said, feel for any lumps, bumps, any abnormalities. And it's important to check behind their ears or just on their back because they don't see it. And then here, I just give him a pre-rinse before going into the intraoral section. Also, guys, if you hear like birds chirping in the back, it's because my windows are open because it's like summertime right now and it's hot. But the next step I do is after his pre-rinse, I just put on his bib, his safety glasses. Oh, our bibs, actually, we don't use bib clips anymore because we have the sticky bibs, like the one that you just stick onto their shirt and it stays right on. And here we go into the intraoral section of the oral cancer screening, and it's basically the same thing, just palpating and like looking for any abnormalities in the entire mouth. We also do palpate the lips, the tongue, especially the sides of the tongue, and check for their throat. So like I've mentioned in the beginning of the video, I had to do laser today on my boyfriend for a comp, but the thing is I couldn't use laser, or I had to use laser before debridement, which is what I did. And with laser, you can't really record because you can't have any reflectives around you for the laser to bounce off of. And after the laser, I went ahead and did his airflow therapy. And watching this video, I did forget something. I forgot to put the solution, disclosing solution. It's basically just what stains the plaque on your teeth so that the plaque is visible to us. But I did every surface on his teeth anyways. Also, let me know below if your school or your office that you currently are working at has an airflow therapy. I'm not sure if this is brand new or like new to dentistry, but I've been loving it a lot. And also, I went ahead and put Vaseline before doing the airflow because air does dry out the lips. So it's lunchtime, and Frankie, how do you feel?
Fresh.
I didn't really scale him yet or anything. I only did laser therapy, like I said, and I also started his airflow therapy. And then when we come back from lunch, that's when I'll do his like debridement, like scaling and stuff. So yeah, because this is my first time using the laser too, and it was a comp, and I was having trouble with trying to put everything together, like plug it in and stuff, or like setting it up. Basically, that's the hardest part. But with the laser, because the glasses that comes with it, you can't really see it. It's really hard to see through the orange.
Because everything is just orange.
But other than that, it was pretty easy. I did it for bacterial reduction because Frankie has gingivitis. Oh, also for lunch, we're gonna get some poke at Fairfield, at the place that we usually eat at Pokimoto. So So we just finished eating our Pokimoto. It was delicious. Thank you. But we're heading back to the clinic now so that I can finish him. And we're actually dismissing our patients early today because there's a meeting with the CDCA people because our board's exam is actually this Monday and Tuesday. So we're meeting with them on Zoom. And yeah, that one is at 6 p.m. They have to be on Zoom at 6. I think that's why we're dismissing our patients like early today, like around 3:30. Yeah, so maybe 4. Like we were able to get dismissed already. So like I've mentioned, Frankie is a holdover patient, and this is actually the PM session now, so he's both my AM and PM patient. And what I'm doing here now is I just hand scaled his entire mouth, and I wasn't able to use a cavitron on him because he had such light accretions or light calculus. And in our school, we are not allowed to use a cavitron if our patient is light. We can only use it on moderate and heavy patients, and I guess that's a good thing because it helps us really like comfortable using the hand scale and not really rely on the cavitron so much. And just really sharpens our hand scale skills, basically. In one of my videos, someone asked me about the loops I wear or what I recommend, and in this video, I'm actually wearing the brand from Oroscoptic, and I didn't really get a chance to choose between what brands because my school actually kind of works with Oroscoptic, but Oroscoptic comes to our school every year and provides our program their loops, so that's what we had. I can actually do a separate video because I'm planning to film a what's in my clinic bag, and I can talk about the loops and like how I like them, and I actually do like them. So a really good trick when trying to debride or scale the anterior teeth is to put a con roll just like what I'm doing here on the lips. And basically what it does, it retracts it for you, and so you don't have to use your mirror or your finger to retract. So you have more free fingers to use. And I usually like to floss after I hand scale because usually there's residue calculus that gets stuck in between the teeth, and flossing it just takes it right off. And I actually use this trick during my clinical boards on the mannequin. So usually whenever you ask your patients whether they floss or how often they floss, they usually say they don't floss because it makes them bleed. And it's really important to educate them that the reason why it bleeds is because they don't floss, and bleeding is a sign of infection or gum disease. So the more consistent they are with flossing, the less bleeding that they will see. Here I'm just drying his teeth to prep to put fluoride varnish on him. This is actually the very last step to the appointment. Whether it's an SRP or prophy, we always use some type of fluoride, and in my school we use varnish, but we always put fluoride on them, and we all know fluoride is our god. So we just finished, I actually finished Frankie's cleaning around like 2ish. He didn't really need a lot done, he only needed like a prophy, not really like an SRP or anything like that. We're actually kind of short-staffed because our receptionist lady went on vacation, and so they had me go help out with a receptionist. So that's what I've been doing for the past like hour and a half. So we're on our way home because, like I said, I'm gonna have my orientation for my clinical boards exam on Monday, and that starts around 6. Sorry, that was me scratching my leg. I have a bug bite. Yeah, it starts at 6 p.m. tonight, and we all have to have our videos on and everything. I didn't do coronal polish because I already did the airflow on him. It's either coronal polish or airflow. That's our rule or policy. Oh yeah, I finished him so early that I didn't even know what to do, and I didn't like want him to wait really long, so like I just flossed his entire teeth for him, and then I showed him how to floss with the floss threader because he has a lingual bar on his mandibular interiors.
Period.
But Frankie's a recall patient, so it didn't really take long, and he even said I've gotten way more efficient with what I've been with all my cleanings and stuff like that. Is that what you said, Frankie?
Yes. Yeah, Gwen got like, if I was to put percentage, she would be like 20% more efficient since the last time. And the last time I had a cleaning with her,
It was back in October.
It was in October, and I could feel that this time she was really like on her stuff, and it was nice. But the good thing about Gwen is if you schedule an appointment with her, she's really gentle, but she still gets make sure she fully like cleans you. Because I notice when anyone else does my teeth, like it hurts.
Like if I were to not, like when I was probing him, I remember like I'm not even 1 millimeter in, not even a millimeter in, and he's already like flinching. Like that's how sensitive Frankie is. Oh my god, I completely forgot. I don't know if I mentioned this, but when I saw his he had a PA done back in December with his old dentist, and we saw a supernumerary teeth on top of his number 9.
You have to tell them what that is.
Or number 9, is it 9? 8. Okay, well Frankie's gonna explain to you guys what a supernumerary teeth is since he has one.
Okay, so basically I have an extra tooth up here that's growing the opposite way into my brain.
It's not going in his brain.
The funny part is I have a missing tooth at the bottom, so I was gonna joke with her professor that I could have used the extra tooth down here, but she didn't seem like
The joke.
she didn't like seem like the
Jokester.
joking type, so I just kept it to myself.
Yeah.
But like,
My professor is like someone who's like kind of serious. Like she's amazing, but she's just like I don't know what her humor is. So like we didn't want to
I
say
didn't want to offend her.
So yeah, basically a supernumerary teeth is extra teeth that you have. It's not a bad thing. It's like an anomaly. So it's like a variation of normal. But surprisingly, Frankie had a lot because he was telling me growing up, his dentist would always pull teeth out because he had so many extra teeth. And like ironically, like his brother is missing teeth. So he had all the teeth that his little brother is missing. We have a program called Give Kids a Smile Day, and it's basically free service, free anything, x-rays, sealants, and even like their prophy, like it's all free. And I need a pediatric comp patient, so it's great that I'm able to see his little brother for Give Kids a Smile Day, and it's free. And I'm planning to do my sealant comp on him too. So I think I'm gonna close out the video here because, like I said, all I have to do when I get home is go to my orientation for my clinical boards on Monday. I hope you guys enjoyed my video today. What do you want to say to them?
Hi guys.
You have to say bye.
Bye guys.
We'll see you guys in our next video. Bye.